There's a second pandemic on the way, a pandemic of misinformation around COVID-19 vaccines. A recent study by Johns Hopkins University of 67 countries found that vaccine acceptance has reduced significantly from July to October this year. India, thankfully, does not have a coordinated anti-vaccination movement like the West. But while the much-awaited COVID-19 vaccine is almost here, it is vital to build public trust. Let's look at some of the vaccine misinformation that's already viral. Misinformation number 1. The RNA vaccines will alter human DNA. The Moderna and Pfizer vaccine candidates use mRNA, which is a new and unproven technology. Still, experts say that this is an easier and faster way to produce vaccines as compared to the traditional one. The technology uses a genetic platform called mRNA, short for messenger RNA, that directs the body's cells to stimulate the immune system and generate an immune response against a virus. Since the technology is new, there are possible side effects. But no, modifying DNA is not one of them. Misinformation number 2. Vaccine contains aborted male fetus. The Oxford AstraZeneca vaccine is manufactured using the HEK293 producer cell lines, which stands for Human Embryonic Kidney 293 cells. While the original cells were taken from the kidney of an aborted fetus in 1973, the cells used nowadays are clones of the same and not of aborted babies. Misinformation number 3. Metals used in the COVID-19 vaccines will create antennas in the body for the 5G technology. Claims around 5G technology causing COVID-19 has been around ever since the WHO labeled the disease a pandemic in March. The Quint has reported on how these claims were unscientific and baseless. The claim that vaccine contains metal chips is also false. The claim perhaps stems from a report that said that the US Department of Defense had awarded a contract to manufacture COVID-19 vaccine syringes with RFID or NFC chips. The chips were not inside the vaccine but only in the syringes to give health administrators the details of the areas in which the vaccine was being administered. So no, your bodies will not turn into walking antennas. Misinformation number 4. Bill Gates said COVID-19 vaccine could kill nearly 1 million people. Bill Gates has spearheaded a plan for COVID-19 vaccine and has committed more than $300 million in the response to the novel coronavirus pandemic. However, that has put him in the center of a barrage of COVID-19 misinformation, most publicized by anti-vaccination groups. This false claim originated from an interview of Bill Gates from May 2020. In the clipped viral video, Bill Gates was talking about the possible side effects and gave a hypothetical figure to illustrate how many people could be affected by it worldwide. Misinformation number 5. The COVID-19 recovery rate is very high, so we don't need a vaccine. After the COVID-19 vaccine candidates came out with their efficacy rates, a claim went viral on the internet that said that since the recovery rates in some countries are higher than the efficacy rates of the vaccines, we don't need a vaccine. Cricketer Harbhajan Singh added fuel to fire when he tweeted the same message that was liked and shared by thousands of his followers. Although India's recovery rate is very high, that does not mean that India will not require a vaccine. The COVID-19 pandemic has resulted in the deaths of at least 139,000 people while reporting of this story. Vaccinating the population will make sure that people are not exposed to the virus, thus preventing deaths and hospitalizations. Social media giants like Facebook and YouTube are doing their part in curbing misinformation by banning anti-vaccination ads and content. India has been in favor of mass vaccination that led to the eradication of diseases like smallpox and polio. But with the massive amounts of unfiltered content available on the internet, we need louder pro-vaccination voices to be able to reach the masses. If you come across any vaccine misinformation, WhatsApp it to us at 964-365-1818 or email it to us at webcoof@thequint.com. Until then, keep following the Quint Fit and don't be a webcoof.